Arterial puncture, withdrawal of blood for diagnosis. The physician inserts a needle through the skin and punctures the artery to withdraw blood for testing. No catheter is left in the artery. Pressure is applied to the puncture site to stop the flow of blood. Spinal puncture, lumbar, diagnostic. During a lumbar puncture, a needle is inserted between two lumbar bones to remove a sample of cerebrospinal fluid. Spinal puncture, therapeutic, for drainage of cerebrospinal fluid, by needle or catheter. The L3 and L4 vertebrae are located and local anesthesia is administered. The lumbar puncture needle is inserted. In some cases, spinal fluid is drawn through the needle. In other cases, a catheter is inserted and the fluid empties into a reservoir. Puncture of shunt tubing or reservoir for aspiration or injection procedure. The physician injects or aspirates the shunt tubing or reservoir with a needle to determine function. Shunt tubing eliminates excess cerebral spinal fluid. The tubing runs behind the ear, through neck tissue, and into the gut. The physician places a needle into the tube or reservoir and injects radiologic dye, or aspirates to check for effective drainage. Pleural drainage, percutaneous, with insertion of indwelling catheter, without imaging guidance. With imaging guidance, the physician removes fluid and/or air from the chest cavity. The patient is positioned dependent upon the location of the fluid, blood or pus, on pre-procedural imaging. The chest cavity is accessed by puncturing through the space between the ribs with a needle. Once the fluid is accessed via the needle, a guidewire is inserted to the most distal point of the fluid in the pleural cavity. A catheter, i.e., pigtail catheter, is inserted. The length of the guidewire and the chest cavity is drained. In some instances, the catheter is connected to a water seal system. Subdural tap through fontanelle, or suture, infant, unilateral or bilateral, initial. Subsequent taps. The physician draws off cerebral spinal fluid through a cranial or fontanelle suture in an infant. The physician places a needle through the fontanelle at the suture line until cerebral spinal fluid is obtained. The needle is withdrawn and the area is bandaged. Ventricular puncture through previous burr hole, fontanelle, suture, or implanted ventricular catheter/reservoir, without injection. With injection of medicament or other substance for diagnosis or treatment. The physician withdraws cerebral spinal fluid. In 61020, the physician places a ventricular catheter through a previously formed burr hole or fontanelle suture and withdraws fluid for study. In 61026, the catheter is used to inject a medication or other substance for diagnosis or treatment. Tracheal puncture, percutaneous with transtracheal aspiration and/or injection. The physician punctures the trachea with a needle to aspirate secretions or inject a therapeutic agent. The physician palpates the site and inserts a hollow point needle. Secretions are aspirated or a therapeutic agent is injected. The needle is removed.